This is Dr. Tyler Hamel, chiropractor nutritionist in Kingwood, and today we're going to show you an adjustment, an example of a manual adjustment. First we're going to do the thoracic spine and then the lumbar spine. And the reason we do that as chiropractors, we find lots of times spine and nerve irritation, and that's leading to somebody's pain, neck pain or back pain, mid-back pain. So we're going to adjust that now and you'll see how that happens. Okay. Can you bend your knees up for me?
Absolutely.
All right, let's have you hug yourself like so. All right, take a deep breath. Let it out. Relax the shoulders. Good. Deep breath. Let it out. There we go. Okay. Then on your side face and be this way. All right, keep that bend, that straight. Yep. All right, take a breath. Let it out. Good. Excellent. Okay, let's do the other side. All right, take a breath. Let it out. There we go. Okay, on your back. All right, and that's it for the adjustment. So you might hear some little pops and cracks, and all that is pressure being released from the area. And when we do that, it helps us get say the low back moving a little bit better, or the thoracic spine moving a little bit better. So thanks for watching this video.